Okay, so it's 6:05, so I'm gonna go ahead and start and just get through like all like general housekeeping kind of stuff. So if you're new, welcome. I don't think we have any new members in here, but if we do, welcome. It's great to see you. And then, so I know everyone is wanting to know when we're getting our spring shirts and masks in. They're on the way. They should be here hopefully by Monday. So I know that's during spring break. So if anyone is around during spring break, I'll be around. So I'll be able to meet with you if you want it early. But if not, we'll probably try to host a couple of days where you can just come and pick it up. So we'll keep you updated on that. But they are on the way. They're getting here, I promise. And then if you are graduating this semester or in the summer, make sure you email us or email me if you have been a full-time member for 2 consecutive semesters. And make sure you do it by April 1st. That way you can get a graduation cord. If you don't email me or you don't fill out the form that we'll send out to you, then you won't get a cord just because we won't know. So make sure you do that. And then we are still selling our old shirts. We did have our fundraiser last week and we raised about $400 from the baskets alone. So that was really good. But we are going to continue selling the t-shirts until April 1st, just so we can give you guys a little bit more time if you want them. It'll go directly to the Bawa Health Initiative. After April 1st, if you still want to buy them, that's perfectly fine. It just won't go towards the Bawa Health Initiative and it'll go towards like the SHAMOS scholarship that we have every spring. So some more volunteer and hour opportunities for you guys. So the meetings are still worth 1 hour each. We still have some blood drives in March and April. So we'll get to the slide that has all the dates there. Food donations to the Sam Houston Food Pantry, Rita B. Huff, or the Alzheimer's Association or the American Heart Association. And then also we have vaccination drives too. So more about the vaccination drives. There were 2 positions that we could do. So you could either do data entry where you input patient names and information, or you could be a runner. So basically you run materials back and forth to whatever station needs it. Next week, there's Monday and Tuesday. They still need people for data entry. And then also on Saturday, on the 20th, they need a runner. There's only 1 spot for the runner on Saturday. So we'll email you guys the link to sign up, or you can go into the welcome packet and there's going to be a little link there that you can click on and sign up that way. All of the dates are from 8:30 to 5 p.m. So you'll get a ton of hours. It'll be really good for you to do. I've heard that being a runner is really fun. So from the couple of people that have already done it, they said running was really fun. So if you want to do that, there is 1 spot left. And then both of them are in Huntsville. So the ones during the weekdays are at the Walker County Fairgrounds, and then the weekends is at Huntsville Family Clinic. And then we also do have the physician assistant virtual fair that's going to be on April 7th. I know it's like a little bit early, but it'll be from 9 a.m. to 9 p.m. Just record how much time you spend in the virtual fair, and that's how we'll record your hours for it if you do it. And then also the registration link is also going to be posted in the welcome packet and on GroupMe to kind of help you guys out. So blood drives, the dates that we have left are the 23rd, 24th, 25th, and 30th of March, and then the 8th, 19th, and 20th of April. So you can get 2 hours for donating red blood cells and then an additional 2 hours for double red blood cells or plasma. So that'll be 4 hours if you do plasma or double red blood cells. And then 1 hour if you try, but you get rejected for any reason whatsoever. And then also 1 hour for every hour that you pass out flyers. I have a ton of flyers. So you can either email me or Denise and just let us know if you want to pass out flyers at any point in time and we'll meet with you and give them to you. All the blood drives are from 12 to 4:30 p.m. in between the chemistry building and the life science building on the 2nd floor. And then if you do choose to donate, you do have the opportunity to have antibody testing. So if you're interested in knowing whether you have antibodies or not, this will be an easy way to do it. And then this is our coordinator information. So if you have questions about your eligibility to donate blood, she'll be able to give you better answers than we will. So just send her an email or you can message us. And then we have our phone number too. If she doesn't answer her email, we'll give that to you. So this is all the information for the rest of the month of March. So like I said, we have the vaccination drives on the 15th and 16th and 20th, and then the blood drives on the 23rd, 24th, and 25th. And then on the 25th, after spring break, we come back, we have Texas Tech Medical School. So if you're interested in going to Texas Tech or you're interested in their program, make sure you attend the meeting or watch it later. And then we also do have some officer positions that are going to be opening for the fall 2021 to spring 2022 year. So whenever you run for an officer position, it's not by semester, it's going to be for the full academic year. So make sure that you're able to do that. So we have the philanthropy chair. So the philanthropy chair is in charge of scheduling and managing the blood drives and volunteer and service events. And the treasurer is involved of all the basic finances and financial decisions. The good thing about being treasurer is that you can tell us no. Not a lot of positions have the ability to do that, but as a treasurer, you can tell us no. And then the social events chair is in charge of planning and scheduling the in-person social events that we typically have. Usually we have like, holiday events before instead of meetings or whatever. So they'll be in charge of planning that whenever we're able to do so. And then these are just some useful links. So you do get a BMO academic consulting, discount of, I believe it's 10%. I'll have to double check, but I'm pretty sure for a member it's 10%. And this is the link to the MedSec application. I believe it closes the week after spring break. So if you're interested, then the link is there for you. And then as well, advising is open. So if you haven't been advised, you should probably get advised because you're going to need to do that really quickly. Because I believe registering for summer and fall, I believe it might just be summer, but it opens up in April. So it's coming up really fast. And then I also added an undergraduate tuition link for excessive hours because I didn't know this as a freshman. So I think it's good for you guys to know. After you get past a certain number of hours total, so all the hours that you've withdrawn from, dropped, and failed, they count towards this. So like for me, I'll personally be over my hours because I did drop and fail a semester worth of courses. Not really happy about that, but hey, it happens. So because of that, I've reached my 150 hour limit. So I'll be paying twice as much for courses after that. So that's just something to look into and be kind of sort of cautious about whenever you are like signing up for a ton of classes and stuff. Just be aware that whenever you drop them, it still counts. And then, of course, we probably don't have like a ton of freshmen in here and it might be a little bit late, but there are learning communities. I have information on there too. And now we have several guest speakers. I actually only put one name on here. I apologize, but we do have multiple guest speakers here today. So I'm going to stop sharing my screen and then I'll enable it so that you guys can share yours. And then that should be good. So you're good to go.
Hi, everyone. My name is Alexis. I'm an admissions counselor here at Sherman, and I'm really excited for you guys to join us today and get to know a little bit about Sherman and who we are and what we represent. You will be hearing from multiple people. We have Victoria, who is a student ambassador. She is on her 14th quarter here at Sherman, so she is at the finish line. She's almost done. She'll be going over student life, campus activities, really what it means to be a student here at Sherman. And then we also have Dr. Campos. He is a chiropractor, has been for many years. He's actually the head of our war program here on campus too, which is all about recruitment. So he'll be going over a little bit more in depth about the career itself. So I think we can get started. I think everyone's joined on, so we can get started with Victoria. Victoria, do you want to go over a little bit about campus life and student life?
Yeah, sure. First, what I want to do, Morgan, if it's okay, I want to learn a little bit more about you guys first, so I can kind of tailor a little bit of what I'm saying to something that particularly interests you guys and kind of what your organization is all about, kind of what your goals are, what your heart is, what your kind of direction is with your organization, so I can kind of tailor what I have to say to you guys a little bit.
Yeah, sure. So basically, the acronym is Sam Houston Association for Medically Oriented Students. So it's not just a pre-med organization. Mm-hmm. We're predominantly run by pre-med and pre-nursing students, but there are a lot of variety too. So pretty much our whole goal is to just give students a ton of resources to a ton of different types of medical professionals and fields so that they kind of have an idea. If they don't know what they want to do, they can hopefully figure it out.
Fantastic. Okay, so good. I actually was pre-med before I came to chiropractic school. So I'll give you a little bit of background about me and why I chose chiropractic. I wanted to be an OBGYN for the longest time, loved babies, loved delivery. I was able to shadow a natural delivery and be in a cesarean section. I loved that part of it. I love surgery, and but it just didn't work out for me. There are some parts of the job that I just didn't feel like I was being called to do, or felt like I would be able to sleep at night knowing that I had to do certain things. So I was like, we're just not going to go that direction. I shadowed dermatology. I shadowed otolaryngology, got to hold a little kid's like 7-year-old tonsils. Like I'm standing over the head of the doctor and he's like, here, stick your hand out. And he drops like this kid's tonsils in my hands. And I'm like, oh my gosh, they're warm. I don't know what to do with this. I was right in the same shoes as you guys were. I was probably a sophomore, junior in college when I did all that. Got to see a partial lobectomy of thyroid. So that was really neat. And he's pointing at things with his forceps and he's like, what is this? And I was like, I don't know. I was like, a nerve of some sort. He's like, no, honey, I wouldn't be touching a nerve with my forceps. I'm not going to do, it's the parathyroid gland. I was like, okay, I have no idea, please don't hate me. But anyway, so I did all that, ended up wanting to do family medicine. My reason for wanting to do family medicine was the fact that I could see I could be exposed to anything at any time. Family medicine is a triage of sorts. So you're going to be able to see, you're the gatekeeper, you're a primary care provider, and nobody needs a referral to get to you. You're not a specialist. So you kind of get a wide berth of different conditions that are going to come in the door. You have no idea. So you've got to be on top of your game in every single specialty. And I really like that unpredictability of that kind of job. And I shadowed osteopaths in particular. What I really, really enjoyed about the osteopaths was a particular part of what they get trained in, which is manipulation. So it was OMT, or osteopathic manipulative therapy. So they would do sessions with their patients that dealt with using long lever systems to stretch muscles and relax muscles. If people were coming in with headaches, they would do a release of like the RCP major muscles and these occipital muscles right behind your neck right here that are really tight. And they would just do some manipulative therapy there and some releases there. And it really helped patients with headaches or low back pain, whatever it was they were using. Whoops. Sorry, hang on. Remind me later. I'm coming back. Something just came up. Adobe wanted to refresh or whatever. Okay, I'm back. But what I enjoyed about that was the fact that these doctors were just using their hands. No drugs, no surgery, no instruments of any kind. I was like, you went in there and put your hands on these people and helped them to feel better. And that was like a literal light bulb for me in my head. It just like went off. I'm like, that is exactly what I want to do right there. But that's really the only part of it that I want to do, because I actually, after I graduated undergrad, so I took the MCAT summer of junior year, or the summer after, whatever that is. We're on quarter systems at Sherman, so it's completely different. So I'm trying to remember again what like a 16-week semester looked like. But anyway, I took the MCAT 2 weeks after my junior year in college. And then after I graduated, I was planning to take it again. And I took a gap year. So I started working in the family medicine residency clinic that I had shadowed in previously. And that was when I really saw the behind the scenes of how the kind of the medical field, the medical system worked. Because when you shadow, it's an awesome experience because you get to see all the guts and the glory. Then I started working in it. And if I have any of you that are CNAs or you're BLS certified, that's something that I was doing in order to kind of buff up my resume to go to medical school, because you have to have all these, so many things, they look at all this kind of stuff. So I was doing that. Those are kind of things where you can get more behind the scenes. So I was working as a receptionist, and I was getting cussed out and yelled at every single day by some patient whose Percocet wasn't at the pharmacy, or their hydrocodone wasn't in the amount that they wanted, or it wasn't the dosage that they wanted. So I was getting yelled at. My doctors were getting yelled at. I'm literally hearing patients scream at my doctors because they're not getting what they want. I'm like, holy cow, is this really what I want to get myself into right now? That was a moment for me that was a little bit discouraging on my heart. And I was confused because I really felt like the Lord was calling me into being a medical doctor. That's what I wanted to do. And my residents were fantastic, and they're phenomenal doctors, and they're just doing great things in the world. But I just did not feel at the bottom of my heart that that's what I was being called to do. It really bothered me because I didn't have a peace about it. I'm like, I don't understand, because I have this passion for taking care of people and being in the healthcare field, but it doesn't feel right. One day I'm driving home from work, and it was just like the skies opened up, and sun was shining down on me on my drive home from work at 5 o'clock. And it was like, what about chiropractic? And I just started crying. It was this huge emotional release at this thought. What about chiropractic? Well, I had been to a chiropractor since I was 7. I was never seen by the chiropractor, but I had been to one. Like, my mom was going to a chiropractor, so I was at a lot of her appointments ever since I was 7 years old. When I was about 14, I was bucked off a horse, and I landed straight on my chest and knocked the wind out of me. And that was not a fun experience. But 2 years later, when I was 16, I started manifesting some chest pain. I was like, it hurt to breathe. I was like, do I have some kind of costochondritis, or, what's going on? I ended up going to my mom's chiropractor, and he looked at my back, and he adjusted one bone in my back. And immediately after that adjustment, I could breathe better. And I was like, what is this voodoo? I don't know what this is, but that's awesome. So I had some exposure to chiropractic before. And this moment when I'm driving home, and, it was like the Lord is telling me, hey, now that you had to go through all of this to kind of see that medicine is not what your heart is here to do. What about chiropractic? So I looked at Sherman College specifically. And my chiropractor had been there. And so I asked him about that. And he's like, well, you got to go to Sherman. I was like, well, you went there and you're biased, so I'm going to ask somebody else. And so I asked my undergraduate professor, who taught me anatomy and physiology and neuroanatomy and pathophysiology. He was a chiropractor. He went to Texas Chiropractic College. And I said, Dr. Knepp, I'm interested in potentially becoming a chiropractor. What do you think about Sherman? And he's like, I think it's a great school. I think it has a very well balanced curriculum. So in chiropractic, we have 3 kind of focus points of what we stand on, and that is an art, a science, and a philosophy. So the science is like what everything is, like it's the facts, it's it's how everything runs, it's the what. The philosophy is the why. Why do we do what we do? All of you have a philosophy. All of you have something that drives you. All of you have something that it motivates you towards something. Why you wake up every day. That's your philosophy. That's your why. And then the art is how you accomplish that. So he said they have a very well balanced curriculum. They're not too heavy in one of those 3 areas over another. And it's a small school. So I was homeschooled growing up all the way through high school. I dual enrolled when I was in high school. And then I went to a small Christian college in South Carolina called North Greenville University, where I was pre-med. And so at Sherman, there are 400 of us, and it is a great time. Everybody knows everybody, for better or for worse. But that's what I enjoyed about it, because it's very much a family. So what you're going to learn as a chiropractic student is similar in medical school. So our first 2 years are science-based, and we have a total of 4 national exams to get our license. So after your first 2 years of straight academic work, you'll take a national board exam. And then your next year and a half, so chiropractic school is 3.5 years, medical school is 4. In chiropractic school, it's 3.5 years. Your last year and a half is your internship, or kind of like, it's almost like a residency in a sense, because in medical school, your 3rd and 4th year are going to be spent doing rotations in different specialties, right? In chiropractic, we just focus on the nervous system. We're just focusing on the spine. So that's kind of what we do. Anyway, so that last year and a half is our, residency, if you will. And so we're strictly working in the clinic for a year and a half. And so that's what I actually just finished up my very last day in the clinic today. That was a very emotional experience. I've cried. See Dr. Campos nodding his head over there. He's like remembering his time back in chiropractic school. But that's what I've done and just finished up today. Do you have any particular questions about what we do? I really feel like I've been talking too long, and I want to bounce this off to everyone else, because I will talk your ear off, and I love doing it. So if you don't have any particular questions for me, because I can always come back and chat, but that's just kind of a brief overview of me, why I do, why I became a chiropractor, even though I was pre-med ahead of time, and a little bit about our program, and just what it runs on a quarter system, like I said. So it's 11 weeks, and then you get a 1-week break, and then you go on for another 11 weeks, which I personally love. It's very fast paced. You'll take between 8 to 10 classes a quarter. The kind of, to compare it, it's the same amount. How do I say that? It's about 3 undergraduate degrees is the amount of material that you're going to ingest in 3.5 years. At least that's what I was told in 3rd quarter by one of my professors. And I was like, he's got to be kidding, right? Like, he's got to be kidding. But it's a total of 5,000 hours in chiropractic school. Yeah. And Sherman is extra. It's a little extra crazy, because it's like 2,000 credit hours more than what you actually need. But Sherman's like, we're the best. We want to give the best quality education in chiropractic. So we're going to give you 2,000 hours more of everything that you need to know. So with that, I'm going to pass this off either back to Lex or Dr. Campos, and I'll let them continue this little bit.
Thank you, Victoria. I just want to let everyone know that I will be putting a couple of links in the chat here about what Victoria has talked about. And then also a little bit throughout the conversation with Dr. Campos. I'll just put them in the chat here on the side for you guys to look at. But I think we're ready for Dr. Campos. If you want to kind of give us a little bit of an analysis of the career itself, I think you have the floor.
Absolutely. My name is Jorge Campos. I am a chiropractor. I am from Santiago, Chile, just like the Mandalorian, Pedro Pascal. That's why I have the cool accent. And I graduated almost 12 years ago. And after graduation, I moved to Patagonia, Chile. And I practiced there for 10 years. And it was a fun ride. But before I tell you everything about that, well, I won't tell you everything, but some neat stories about that. I actually like to tell people where this profession comes from, because people think that chiropractic is only about back pain or headaches, and yeah, it does help quite a bit, but it's not really about just that. The year was 1895, And there was a man in Davenport, Iowa. His name was Diddy Palmer. And he was kind of like a holistic healer at the time. And where he was working, there was a man. His name was Harvey Lillard, and he was the janitor of the building. And he told Palmer that one day he was trying to pick up a heavy bucket, and he heard like a popping sound on his back, shoulder, neck. And the next day, he couldn't hear anything from his right ear. So Palmer thought, okay, that's kind of weird. When did that happen? 17 years ago, he said. I said, okay. So he started like touching the spine and the neck, and he felt that it was like lumpy and hot and not moving right. So he applied a pressure there, and he got the classical cracking sound. And then after that, startled Harvey Lillard, and he asked Palmer, why are you being so loud? And Dr. Palmer was like, what do you mean? I'm not being loud at all. He said, wait. I can hear the horseshoes on the street. So after that adjustment, Harvey Lillard recovered his hearing. So he left the office, and he started telling the entire town in Davenport, Iowa, that he recovered his hearing thanks to Dr. Palmer pushing on his back. And also Palmer was so innocent that he thought he discovered the cure to deafness. So they started bringing a lot of deaf people to his office. And lo and behold, not a single other deaf person, recovered his or her hearing. However, when people started coming in and he started adjusting, manipulating the spine at the time, he noticed that people would report the headaches went away, low back pain felt better. They were going to the bathroom every day instead of every other day. Even a person reported that his hemorrhoids went away. So he was like, okay, that's kind of weird. It's interesting. So then, learning more about the spine and the nervous system, he realizes the spine is the house of the central nervous system. Your brain is protected by the cranium, and then all your central nervous system, your spinal cord, honestly, I like to call it the brain cord because it's the continuation of your brain. It's covered by the spinal column. And if there's interference there, that communication between body and brain is not going to be 100% efficient, and you're not going to have the right communication. Now, when you hear this story, you're like, oh man, that's kind of weird. I don't think it's real, because hearing is about a cranial nerve, it's not on the spine. So it doesn't make sense that someone is going to push in your spine and you're going to recover your hearing. And I would have to agree with that. However, there are a couple of nerves that they had to do with the muscles of the ear, tensor tympani and things like that, that they're related to the spine actually. But what is interesting is in 10 years of practice, 2 people have recovered their hearing after an adjustment in my office. So one was a lawyer. He was involved in a car crash accident, whiplash, and then he couldn't hear anything after the whiplash. And the other one was a young mom. She was trying to pick up a bunch of groceries and the baby, and it was very similar to what happened to Harvey Lillard. So to me, that was really cool to see it live in my office. Like, that's how the profession got started, because someone recovered his hearing, not because someone had low back pain. And it was cool to see it live. It's like, wow, this is really awesome. So the biggest difference between chiropractic and medicine is that medicine is the study of disease, like what is making you sick. And the doctor will do the best, will give you medicines, surgeries, will do whatever to take care of the disease. Chiropractic is about the nervous system, regardless of the disease or condition that the person has. So it's about making sure that the nervous system is firing to the right parts, areas of the body without interruption, so you can actually adapt better to your environment and to yourself. So having said that, I was able to go back to Chile. I was the only chiropractor for about 350,000 people. I used to work 12 hours a day, and I did have to see a lot of people. I was the only one. So they didn't have a choice and I didn't have a choice. But it was definitely a fun ride. And I got to see, if I have to give you a number, I would say probably more than 300 different cases, anywhere from a headache to a couple that couldn't have babies, to kids that they were wet in the bed. All these things are related to the nervous system. And actually, I'm going to give you a challenge. Try to find a disease that is not related or will not have an impact in your nervous system. Good luck with that. So if your nervous system is working properly and you add a good lifestyle and whatever the person needs from the medical end, you're going to have a very healthy and prosperous individual. So I don't know if you guys have any questions, any comments so far. Did you know that chiropractic started because of someone recovered his hearing? Probably not, right? So yeah, that's pretty neat. So yeah, Victoria gave you the student life. It is a cliche, but it is real at Sherman. But at Sherman, you get to meet a family. Like everybody knows each other. They take care of each other. You go to the kitchen and there's food for everybody. It is really, really cool. And it is not an easy program. Chiropractic itself, like she was saying, the science part, everybody has to pass national boards regardless of the school you go. So they all are going to prepare you to pass the national board so you can get the license. But Sherman will also help you to become a better and really good technician, because it's an art, kind of like martial art. When you're learning to throw punches and things like that, you got to have control, you got to have speed. So you become a really good technician with your craft at Sherman. Also the why we're doing what we're doing, the philosophy. And on top of that, we also cover the business part. So we do talk a lot about business, because most likely if you're a chiropractor, it's just like a dentist. You could go work in a firm with more dentists, but most people, they want to go the solo route and open up their own practice. So you got to learn how to run a business if you're going to do that, especially if you never run a business and your family or your dad or mom never taught you how to do it. So we do that at Sherman as well. We teach you the business part of chiropractic. Yep.
I kind of want to pick up there a little bit with what Dr. Campos is saying about running a business, because for my ladies here, if you're looking at, being, you want to be a mom one day, it was really important for me when I was in your shoes. I mean, I wanted to be an OBGYN. I wanted to be a surgeon. I wanted to, be delivering babies, which meant that I was going to be on call and I could be, taken away to, do anything at any time. And that was something that I was a little bit concerned about, because I was homeschooled growing up. So I was used to being around my mom a lot. That was really important to me. And that's something that I wanted to be able to give to my future family. So I was thinking of going more the PA route. PA is also really cool because you can change specialties and you don't have to take a bunch of board exams to do that. You're like, I don't want to do this anymore. I'm going to go do cardiology or I'm going to do plastics. That's what I'm going to do. But that's something that I found really attractive becoming a chiropractor, because that means that as a business owner, I can make my own rules, my own schedule. If I only want to work on Sundays, like I can get away with that because I make my own rules. And that was really attractive to me personally. And then in chiropractic, we also have they're kind of like specialties, but it's like we work with animals. If you really like working with animals, there's animal chiropractic. There's also, if you want to do more sports, you can learn more about specifically dealing with sports kind of stuff. I, again, like mamas and babies. So there is a kind of sector of chiropractic where you can learn more. You can get a diplomate in pediatrics and pregnancy. So that's something that I'm particularly really interested in. And that was something that I thought was crazy coming into chiropractic, because I was sitting in class one day, and I've heard this from multiple chiropractors, and I'm sure this has happened in Dr. Campos's office, and I cannot wait for this to happen one day, because I know I'm going to have some patients that this is going to happen for me, and I'm so excited. But there are women who come in with the perception that, chiropractic is about neck pain, back pain, and headaches. So a woman comes in with back pain because that's all that chiropractors do, apparently. We're good at it. We're good at taking care of, pain, but there's so much more to it. Why are we experiencing these things? That's what chiropractors are trying to find out what is the root cause for why we're seeing some of the symptoms that we're seeing. So anyway, some ladies are coming in with low back pain, and they don't tell their chiropractor that they've been told that they can't have kids, because what do chiropractors have to do with that? Anyway, they start getting adjusted in the low back. Well, what do you think the nerves in the low back go to? They go to the uterus, they go to the ovaries. Does it make sense that if there is inflammation in the nerves in the low back that go to the uterus, that go to the ovaries, does it make sense that there may be some kind of disruption between the messages being sent from the brain to those organs? And then if the brain can't properly send messages to the uterus, to the ovaries, are the ovaries going to produce the proper amount of hormone levels? And is that going to communicate properly to the pituitary gland to reciprocate proper hormone levels? Probably not. There's also research in showing how chiropractic care, they'll monitor the actual, like the thickness of the uterine lining, and that will change under chiropractic care to where it increases in thickness to be able to house, a little one, to house an embryo. And when I'm hearing these stories sitting in class, and these women are coming in, with low back pain, and then coming back and saying, "Doc, I am expecting, how did you do that? Like, I am able to, people told me, my doctor told me that I couldn't have a baby." I'm going, that is a miracle. And my teacher was like, it's not a miracle, it's physiology. Like, you remove the interference within the nervous system, you allow the nerves to heal and communicate properly with whatever they're attached to, and the body's got to function the way that it was designed to. Of course they're gonna have babies. Like, that's how it's supposed to work. And that just was the neatest thing to me, that I could have a small piece in a person's life like that we are looking at the cause of these interruptions. And there's always a time and place for it. Chiropractic is not the end all be all, by no means. But we really look at things so minutely, and we're looking for, where is their nerve damage? And then what is being affected as a result of that nerve damage? And as a chiropractor, can I find where that nerve damage has occurred in the spine? Because what happens is, through our environmental stressors, we get stressed out by a lot of stuff, right? Whether it's physical stressors, our posture, if it's like a really powerful physical stressor, like a trauma, like a car accident, or, football collision, slips, trips, falls, whatever it is. Are these chemical stressors that we're dealing with, sugar in the body, nicotine, caffeine? Or are we dealing with emotional stressors? So anyone have road rage, like myself here? Like, you're out on the road and you're like, how on earth these like drivers in the South are insane, at least in South Carolina. Like, blinkers are not accessories. Like, use the blinker, please, for crying out loud. But anyway, so what happens when you get upset, when you get triggered? The shoulders come up, the heart rate goes up, these muscles get really tense. You're not going, that sympathetic nervous system kicks way, way up. But there was there's no physical thing involved with that. That's all in your head. You're doing that to yourself. So that's something as chiropractors that we study and we're aware of. What is the cause? And then what happens as a result of that? Our bodies are supposed to adapt to a certain level of environmental stress. I mean, that's just life. If we didn't have stress in our life, we wouldn't be like living. We always have to combat against something that keeps us alive. And so your body's able to adapt to a certain level. However, when your body can no longer adapt to that environment, then we get what's called subluxation. And that's when a bone in the spinal column becomes malpositioned and it gets stuck. So the bones are supposed to move freely. So this is the front and these are the spines in the back, right? So it will actually slip backwards and it will get stuck there. And so it starts moving improperly. It's supposed to be up here moving freely, but it will get stuck back here and it starts degenerating. It starts wearing out and it starts irritating the nerves on either side of that joint unit. Now, not all of your nerves transmit pain. less than 10% of your nerves actually send pain signals to the brain. So we can have subluxation and not even feel it. But there will be repercussions, because if there's nerve damage, whatever that nerve is attached to, if there's inflammation in that nerve, it's not going to work properly. So even though we may not feel it, there are going to be ramifications, and there's going to come a point where there's been so much damage that we're going to see pathology arise from it. So as a chiropractor, we're also proactive. We don't want to be reactive and say, oh, I have asthma, or oh, I have a headache, or whatever it is, I need to go see my chiropractor, so I can get out of pain. We want to be a little bit more proactive. Like, why do you brush your teeth every day, or twice a day? You don't brush your teeth because you have cavities. You brush your teeth so you don't get cavities, and so that's why we do it. We don't have any pain, that's not why we brush our teeth. We brush our teeth to avoid that stuff and keep that good dental hygiene. It's similar for chiropractic. We want to make sure that we have proper nervous system hygiene and good spinal column hygiene, and make sure all of those joints are moving properly and biodynamically the way that they're supposed to for the optimum health of our body, and making sure that everything's functioning properly. And that's what I love about chiropractic, is finding the root cause of things, being able to make a specific gentle chiropractic adjustment, clearing out nerve inflammation, and letting the body heal. So I get to put my hands on people just like I saw my DOs do. It's a little bit different. Chiropractors don't do manipulations. Some manipulations is more gross movement and it's long levers, whereas chiropractors use adjustments, which is quick, high amplitude, low force. Dr. Campos, you're going to help me with that. Good grief. High amplitude, low force, or low. Anyway, quick stuff. It's a quick thrust. That's what it is. I'm like, I don't know. You just push on it really fast, which takes a long time to learn how to do well, but with short levers. So we're looking exactly on how a bone is positioned on an x-ray. That's something that we have to do too. We have to be able to diagnose and read x-rays. I have to see if there's lung cancer or if there's bone cancer. It's out of my scope of practice to diagnose it. I'm not a medical doctor. That's a medical doctor's position to do, but I am still held liable for that information because chiropractors are PCPs. We're gateway providers. You don't need a referral to get to us. So we have to know, we have to be on top of our stuff to say, is this a chiropractic condition that this patient is coming in with? Do I need to refer them out immediately? Can I co-manage them with another provider? What do they need? So that's something that we have to be aware of. So we're looking at x-rays. We learn how to read MRIs. We have to do a lot of that stuff behind the scenes that a lot of people tend to not know, wow, you have to do all that. Yes, we have to do all of that. And it's, you have to be tested and it's all this, it's a little bit frustrating. I'm like, you mean I have to know what all of this stuff is and I can't even diagnose this person with it, even though I know that that's what they have, but I can't say anything about it? Yes, that's what we do. So it's kind of neat. You have to know all of that stuff because you're a doctor. You have to be able to read lab values. So if someone comes in with a lab panel, I'm responsible for knowing what that means. And a lot of patients do that. I'm sure Dr. Campos, patients did that with you. They're like, I don't know what this means. Will you please explain it to me in English? Because doctors have it, I don't care what kind of doctor it is. Once you get onto a level, like a graduate level of communicating with each other, and you guys, I'm sure a lot of you are biology majors or health science majors, a lot of crazy anatomy terms and Latin and all that kind of stuff. You talk to each other in a different language. And so you're having to learn how to then communicate with patients on a regular level. And that's something that that we teach you how to do too. And you'll learn that, wherever you're going to learn healthcare stuff, how to be a regular relatable human, which can be difficult at times when you're just studying, your biology all the time. But that is what I was really attracted to with chiropractic, was being able to use my hands and allow the body to function the way it was supposed to, and allowing people to take more control in their lives and have more autonomy in their healthcare, and not just saying, well, here's a medication for this, here's a medication for this, you're going to have to be on this for the rest of your life. I wanted something a little bit more. I wanted to free people from some of that stuff if that was possible. Again, there's always a limitation to something, but I wanted to be able to help support people in the best way possible that their body was innately designed to function. So Violet, you're a mom already. I can imagine being a mom is difficult, especially in the academic setting. I have a lot of classmates that I think we had three that had babies this quarter, and they're taking classes and they're seeing patients. And that's the great thing about Sherman in particular is, I mean, there's always somebody to pass a burrito, a little nugget to, somebody's like, hey, I got to go take a test. And somebody's just walking by in the hall. It's like, here, will you please take this baby for, 30 minutes while I go take this test? And so people are just running around with babies all the time at Sherman. It's wonderful. But anyway, I digress. Let's see. Does anybody have, I know we need to be probably wrapping it up here soon. Does anybody have any particular questions about chiropractic or what any of that is like? I know you just got kind of vomited a lot of information on. We get really excited about what we do, but
do you guys have like a GPA minimum requirement as well as like generic coursework, core work that you have to do before going?
I think that's a Lex question.
That is my question. So I was going to get to that next, just the admissions requirements and process and everything. But we highly suggest a 3.0 or higher GPA, just because when you come in, you want to make sure you have a good foundation of those sciences. We have accepted below before, but we really highly suggest a 3.0 or higher for that. And basically the admissions requirements is that you have to have 90 semester total hours. 24 of them have to be science or life sciences, physical or life sciences. And then 15 semesters of humanities. And once you've required that, then you will just send us an email sending us your unofficial transcripts. Those will be evaluated, and then you will send us required documents, which can include 2 letters of recommendation. They do not have to be from doctors necessarily. Fill out your online application, which I will include in the chat here for you guys, a link, as well as sending your official transcripts and then 2 written essays. So once we have all of that information, then you'll be accepted and you can start at Sherman. So it's not a long process, but just to make sure you have that good foundation of sciences is extremely important. So you can be successful here at Sherman. Do you guys have any more questions for us? Okay, I'm going to provide the links right here for you guys. And also I wanted to mention about visiting. We really encourage students to visit so you get the good Sherman experience. We are a family here, like Dr. Campos said. So we encourage you guys to come on campus and visit. We have multiple events going on. We have Showcase Sherman, which is a huge event that we hold several times a year. Basically, students from all over the United States come to Sherman with the main point of sharing your passion for chiropractic care. You will meet the president, speak to the president. You're going to be able to talk to faculty and staff. You'll talk to student ambassadors like Victoria. She'll be there, I'm sure. And then you'll basically have a campus tour. So it's a lot of stuff that goes on at Showcase, but it's something you definitely don't want to miss out on. So I will put the link in there for the Showcase as well. And we have campus tours on Tuesdays and Fridays of every week. So if you want to come and visit, all you have to do is just go to the link I'll provide and we'll get you here and experience South Carolina, firsthand. So.
I'm also going to drop my email in here for you guys. If you have any questions, because a lot of times I know that I have to marinate and sit in information for a little bit. And then, later I'm like, well, what about this? What about this? So if you have any questions for me at all, whether it's about chiropractic or, undergrad as, a pre-med student, what graduate, schools to go to and what your thought process is, like going through all that. I would love to just be an encouragement for you all. I know what that process was like, and I know how kind of scary that was, like graduating from college and looking on to that next step in life. Because I knew that just a biology degree was not going to do me much. I was going to have to up it in some form or fashion. So if you guys have any questions whatsoever, I would, love to be able to talk to you. And I'm here for anything that you could, ever need. We just want to be a support system, because that's really what Sherman is it's a big family and a big support system. We want to not only help our colleagues, but help patients and help the world. So that's actually, our motto at Sherman is adjusting the world for a better future. So we want to be anchors and support to, everyone that we meet, and hoping that you all are able to live out the best life that you can for your own personal designed potential. So I'm going to put that in there, should you ever need anything. And Alexis has her email in there as well. So, and we'll get Dr. Campos's in there as well for you guys if you just have any questions. So it was wonderful being with you all tonight. Good luck. I know you guys are probably getting ready for finals, aren't you? That should be pretty soon, huh?
Kind of. We're in like the weird midterm kind of time before spring break. Usually we have either before or right after.
Okay. So like our spring break is in 2 weeks, but that means that like our quarter is done with. So everyone's finals week is our finals week. I don't have any finals because I don't have classes anymore. Thank goodness. But our finals week is next week, and then we go on spring break. So, okay, you guys are right in the thick of just kind of, all right, where do I stand in this class? Am I going to keep it or am I going to drop it? I get it.
Pretty much.
I get it. That's awesome.
Pretty much.
So guys, before we go, we're pretty much almost done here. I want to ask a small favor, or if it's possible. I want to see your faces, if it's possible. If you're sitting in the bathroom, please don't. But I like to see a face with the name. And I just want to share with you just a short story, only 2 minutes. And I want you to think about this. When I was practicing in Patagonia, I went to a radio show and I shared what I know about chiropractic. I finished the radio show, and one of the people that listened to the show came to my office, and it was a man. He came to my office dragging both of his legs, and his wife came with him. He was very shy and he barely spoke. So the wife told me what was going on. And she said, well, this is my husband. He already underwent 2 spinal surgeries, rehab, and he's worse and worse and worse. Can you help him? And my answer was yes. And why did I answer yes? Is because I don't know how much I was going to be able to help him. But if I could remove any interference in his spine and nervous system, I know that his body would work better. So I started working with him. And after 6 weeks of care, I think it was quiet. So after 6 weeks of care, he comes to the office walking almost normally. This guy barely said hi and bye to me. But this day I take care of him. He gets off the table and he says, thank you, doctor, for saving my life. And I was a young professional, just first year graduate. And I laughed. And I said, come on, man, I know it was hurting. I know it was biological sciatica, but that wasn't going to kill you. And after I said that, I realized that I made a mistake because the wife was sitting right there crying. And I'm like, oh, what's going on here? And he says, no, doctor, you really saved my life. When The day that you went to the radio station, I locked my room, I got my gun, and I was going to shoot myself because I was tired of hurting, suffering, being a burden to my family. I was done with life. And right before pulling the trigger, I heard the door. It was my wife. She said, "Hey, there's a guy talking about the spine. Come listen. Come listen." I hit the gun and I listened to the show. And because you spoke so passionately about what you do, I decided to give it a try. And now I'm alive. But if this didn't work, I would have killed myself. So that changed me forever as a professional because I realized that I was not part of healthcare. I realized that I was part of life care. When people are hurting, when people are sick, when people are suffering, they make the stupidest mistakes, even trying to take their own lives, hurting other people, hurting their children. People are not right here because everything is disconnected from them. They're suffering, they're hurting. So whatever you decide to do with your life, if it is medical school, nursing, chiropractic, physical therapy, just make sure that number one, it is something that you really enjoy, that you're not going in only for the title, for the degree, but it's something that's gonna, man, I'm trying to conquer the world today. That was me every day in practice. I didn't need an alarm. Like my passion for what I did woke me up every day. And also make sure that you really learn to love and care about people, and pick a profession that will allow you to do that. So if that's the case, you're going to have a very prosperous life. You're going to be very happy doing what you do every day. Money's going to come easily because you take care of people and people will take care of you regardless of what you do. And that's going to bring a lot of happiness and prosperity to your life and the life of your community. So if you think that chiropractic might be something that you may be interested, come check us out. Sherman Showcase is actually, you get a free ride to South Carolina. We pay for your travel expenses and your hotel. You're gonna gain 5 pounds that weekend, sadly, because we give you so much food, but it's awesome. It's only one weekend, so it's fine. And yeah, you can contact Lex, me, or Victoria, and we can give you more information about it. And if not, unless you learn more about chiropractic today, and you'll be willing to tell people that we exist, because believe me, we do help a lot of people. All right, guys. So thank you so much for being here. You guys.
Yeah, thanks for coming, guys.
Thank you for showing me your beautiful faces. And we're here to help. So shoot us an email anytime.
Awesome, thanks. That's pretty much like it. So like I said, I'll put this up on YouTube and send it to you guys in like a post-meeting email, just in case any of you missed it. And I'll include all of the important links that they're sending. And then that's it. If you guys have any questions, feel free to email me or message me on GroupMe and I'll answer pretty fast.
All right. Nice meeting you guys. Have a good night.
You too. Have a good night.
Bye guys. Have a good night.